So here I am again, Doug Pittman for Signature MD Minutes. Same chairlift, a different day. Today we have abundant solar energy, and at altitude that can be a real problem for the development of skin cancers, the highly invasive and malignant melanomas, which metastasize easily, and the lesser serious ones, namely basal cell and squamous cell cancers. And by chance, I'm riding up the lift with Ben Storms, a patient of mine, ex-ski patroller, outdoor enthusiast. I want you to meet Ben, who's had multiple surgeries on his face for locally invasive squamous cell, basal cell cancers. Tell him your story, Ben.
Hi, I'm Ben. I sailed and skied for years, not using sunblock, really not knowing any better. It first started on my nose. I had the very tip of my nose here, basically the tip of it cut off in a round circle, and then a skin graft put on from behind my ear. After that, we found a couple others on my nose. We did a Mohs surgery procedure, and I'm sure Doug will explain what that is. But basically, if you look down the side of my nose, you can see there's a distinct line right here. That is where they pulled some skin down from towards my eye. If you look at my nostrils, they're two different sizes. I was not born that way. That comes from their cutting on my face. I've had a couple here in my chin that you can't really see. They did them along this line. I could add a word to the wise. It was probably 15 years ago when I first started having these problems, more than that now, almost 20 years. And today I have sunblock by my sink in my bathroom. And in the morning, in one of my morning routine, when I brush my teeth, I put my sunblock on. Whether it's cloudy out, not cloudy out, etc. I always wear a hat with at least a brim or something. I've just learned to stay away from the sun. So if you start to notice or ever have some of this, prevention is the best possible way.
Okay, so Doug Pittman reporting from the Big Mountain, and we'll get back to the office and discuss skin cancers. Welcome to Signature MD Minutes. I'm Doug Pittman. Today we're going to talk about skin cancer. Skin cancer is the most common type of cancer in the United States. An estimated 40 to 50% of all Americans who live to age 65 will have skin cancer at least once. The most common skin cancer is basal cell carcinoma, which accounts for more than 90% of all skin cancers in the United States. The most virulent form of skin cancer is melanoma. In some parts of the world, especially in Western countries, the number of people who develop melanoma is increasing faster than any other cancer. In the United States, for example, the number of new cases of melanoma has more than doubled in the last 20 years. Basal cell and squamous cell cancers are found mainly on the areas of the skin that are exposed to the sun: the head, the neck, the face, hands, and arms. However, skin cancer can occur anywhere. Ultraviolet UV radiation from the sun is the main cause of skin cancer, although artificial sources of UV radiation, such as sun lamps and tanning booths, also play a role. The risk is greatest for people who have light-colored skin that freckles easily. Often those who also have red or blonde hair and blue eyes or light-colored eyes have higher risk. About 10% of all patients with melanoma have family members who have also had the disease. Three types of skin cancer are the most common. Basal cell carcinoma is a slow-growing cancer that seldom spreads to other parts of the body. Basal cells, which are round, form the layer just underneath the epidermis or outer layer of the skin. Squamous cell carcinoma spreads more often than basal cell carcinoma, but still is considered rare. Squamous cells, which are flat, make up most of the epidermis. Melanoma is the most serious type of skin cancer. It occurs when melanocytes, the pigment cells in the lower part of the epidermis, become malignant, meaning that they start to divide uncontrollably. If melanoma spreads to the lymph nodes, it may also reach other parts of the body, such as the liver, lungs, or brain. In such cases, the disease is called metastatic melanoma. To diagnose melanoma, you should look for the following characteristics: A, B, C, and D. A, asymmetrical. B, their borders may be ragged or otherwise irregular. C, their color may be uneven with shades of black and brown. And D, their diameter may change in size. Mohs Surgery, named after Dr. Frederick Mohs, M-O-H-S, who perfected the techniques in the 1930s, is used extensively for basal cell and squamous cell cancers. Mohs differs from other techniques in that microscopic examination of all excised tissue occurs during rather than after surgery, thereby eliminating the need to estimate how far out or how deep the cancer has extended into the skin. This allows the Mohs surgeon to remove all of the cancer cells while sparing as much normal tissue as possible. In this way, Mohs surgery eliminates the guesswork in skin cancer removal, producing the most therapeutic and cosmetic results. In the case of melanoma, initial treatment with a broad excision is the treatment of choice to make sure all melanoma cells are eliminated. The best treatment is prevention, as Ben mentioned earlier, and surveillance to find skin cancers at the earliest possible time. Monthly self-examination and yearly dermatological exams are highly recommended. Thanks for watching.